And here's the thing. Many people already had sleep problems before surgery. Maybe knee pain woke them up at night, or nerves about surgery, or just years of restless nights. And those habits don't magically go away after surgery. In fact, they can get worse at first. Are you ready to get back to the activities you love after knee replacement? Well, we're here to talk about what really works. The Total Knee Success Podcast is your trusted guide before and after total knee replacement. Here you'll find practical tips and evidence-based strategies, not personal medical advice, just education, all to help you manage pain, rebuild mobility, and get back to living the life you love. Let's dive in. Welcome back to the Total Knee Success Podcast. I'm so glad you're here. Today, we're diving into one of the biggest complaints I hear after total knee replacement. I'm not getting any sleep. If you've been tossing and turning or waking up stiff and sore, you're not alone. And there are ways to make this better. Research shows that up to 50 to 60% of patients report poor sleep in the first 4 to 6 weeks after surgery, mostly due to pain, swelling, and difficulty finding a comfortable position. And here's the thing. Many people already had sleep problems before surgery. Maybe knee pain woke them up at night, or nerves about surgery, or just years of restless nights. And those habits don't magically go away after surgery. In fact, they can get worse at first. In this episode, I'll share some down-to-earth, research-backed strategies to help you rest better, recover with more energy, and feel more like yourself again. Let's talk through some of the ways you can make nights a little easier. First, build a consistent bedtime routine. This sounds sort of canned, but do you struggle to fall asleep at the same time each night? I know I do. A steady bedtime routine can reset your body's natural clock. And research tells us that sleep consistency improves immune function and recovery, sometimes even more than the total hours of sleep. Here's what you can try. Do the same 2 to 3 steps every night, like a short stretch or a warm shower or reading. Dim the lights about 30 minutes before bed and skip the scrolling on your phone, watching YouTube shorts and playing screen-based games right before bed. That blue light makes it harder to fall asleep. You don't have to do this perfectly. Even a few small changes in routine can make a noticeable difference. And once you've set the stage with a routine, the next challenge is often just finding comfort. Are you having trouble finding a comfortable position? Let's be honest, finding a good sleeping position after knee surgery can feel like trying to solve a jigsaw puzzle in the dark. And pillows and support can make a big difference. Studies have shown that side sleepers with a pillow between the knees and back sleepers with the operated leg slightly elevated had 20 to 30% fewer night awakenings. If you sleep on your back, place a pillow under your calf, not right under the knee, because that will make your knee flex a little bit more, but try to encourage some gentle extension, which means keeping your leg out fairly straight. And if you're a side sleeper, use a pillow between your knees to reduce pressure on that operated knee, and you'll probably be more comfortable lying on your right side if your left knee was replaced, or on your left side if your right knee was replaced, especially in the first several weeks after surgery. For more on supportive pillows and wedges that can make sleeping easier, you can go ahead and check out totalkneesuccess.com. Next thing to check out, is your leg swelling more at the end of the day? And if that's you, which is quite common, take care of that swelling before bedtime, because that can also make your sleep easier. Research backs this up. Mont and colleagues found that icing plus elevating the leg reduced pain scores by about 25% in the first month after surgery. That's good news. We have something that really works. And here's what you can try. Ice your knee, the front and the back, for 15 to 20 minutes, about an hour before bed. Prop your leg up so your foot is just above your heart, and try some gentle ankle pumps or ankle circles to keep the muscles moving. And think of this as giving your knee a little extra care at the end of the day. It's one more step that can make your nights a little bit easier. But even if your body feels a little more settled, sometimes the mind just keeps racing. It's like your brain didn't get the memo that it's bedtime. Does your mind race when you lie down? I know sometimes mine does. Calming your thoughts can be just as important as easing your body. Research shows that mindfulness-based relaxation reduces insomnia symptoms by 30 to 40% in surgical patients. And here's what you can try. Try spending just 5 minutes doing deep breathing or guided relaxation. There's certainly plenty of apps for that. I'm thinking that might be a future episode. Or you might try writing down your thoughts in a notebook before bed. Then you won't have to keep turning those thoughts over in your mind. Consider playing soft background sounds such as white noise or calming music to help you fall asleep faster. And yes, listening to this podcast before bed counts too. If my voice is putting you to sleep, then I'll go ahead and take that as a compliment. Give yourself permission to slow down. Rest is a part of recovery. It's not separate from it. Next up, watch out for common sleep disruptors. Could small habits be stealing your rest? Even simple changes to your environment or routine can really make a difference. Research shows that keeping your room cool, around 65 to 68 degrees Fahrenheit or 18 to 20 degrees Celsius, improves sleep quality. Other studies confirm that reducing caffeine and limiting your naps during the day matters too. Of course, if you've just had a knee replacement, it's really okay to take a nap during the day. Sometimes you really need it. Try keeping the naps short if you are taking a nap, maybe under 30 minutes. And here's what else you can try. Avoid caffeine after 2 p.m. If you're taking pain medication, consider taking it in the evening to prevent it from wearing off in the middle of the night. And keep your bedroom dark. Newer research shows that reducing light exposure in the evening supports your natural sleep hormones, while getting bright light exposure in the morning, like stepping outside to see the sunrise, helps to reset your body's circadian rhythm. Try blackout curtains or a sleep mask if the light bothers you. Use a fan or white noise to block out disruptions. And you don't have to take all of these on at once. Pick one change that feels doable and go ahead and build from there. And as you think about these small changes, it's also important to know when simple adjustments aren't enough. That's where the red flags come in. Check in with your healthcare provider if you've gone more than a week without any refreshing sleep, if your night pain suddenly gets worse, or if you notice signs of sleep apnea like loud snoring or gasping for air. Reaching out for help is a sign that you're paying attention to your recovery and taking positive steps to remedy problems right away. So let's go ahead and go over the highlights one more time. Sleep after knee replacement can be tough, but you have tools to make it better. Stick to a bedtime routine. Use pillows for comfort and support. Reduce swelling before going to bed. Calm your mind with relaxation. Watch out for sneaky sleep disruptors like caffeine, late naps, or too much light and noise. And remember, it takes time for your body to settle into a normal sleep rhythm again. Be patient with yourself. Healing is a process, and every small step you take adds up. You are stronger than you think, and you're doing better than you realize. Next up in episode 4, we'll talk about nutrition and recovery, how food, hydration, and daily habits can fuel your healing. And just remember, everything here is for education only. I don't know your personal medical situation, so always follow the advice of your surgeon and healthcare team. If you found this episode helpful, I'd love it if you'd subscribe and maybe share it with a friend who's getting ready for a knee replacement. That's the best way to support the show and help others on their journey. And always, for more resources, including links to pillows and wedges that can make sleeping a little easier, check out totalkneesuccess.com. This podcast is for educational purposes only. Visit totalkneesuccess.com for more resources. Follow the show and share it with a friend. Your total knee success is already in motion.